This video provides step-by-step instructions on how to use the QuickVue At-Home OTC Covid-19 test. Before you start testing, wash your hands or use sanitizer. The first step is to remove the contents from the box and identify all of the components within the test tray, including the step-by-step user instructions, a pre-filled tube, a nasal swab, and a test strip. To begin running the test, select one pre-filled tube from the tray and remove the cap. Now, place the open tube back in the hole labeled tube holder built into the tray. This will keep the tube secure while performing the test. If you are performing a test from the 25 test kit, your tube tray will look like this. Now, open the nasal swab by peeling open the wrapper and removing the swab by the handle. Be careful not to touch the swab head. Gently insert the swab a ½ inch to 3/4 of an inch into the nostril, depending on the size of your nose. Firmly rub both nostrils with the same swab before proceeding. If you are swabbing others, please wear a face mask. The procedure is the same. Rub both nostrils with the same swab before proceeding. With children or small adults, the maximum depth of insertion into the nostril may be less than 3/4 of an inch. Once you've collected the sample with the swab, immediately place the swab into the liquid inside the tube and swirl 3 to 4 times. After swirling, leave the swab in the tube for a minute. Set a timer for 1 minute. When 1 minute is complete, carefully remove the swab from the tube. As you remove it, rotate the swab head against the inner wall of the tube to squeeze out as much liquid as possible. Then, discard the swab into your household waste. Next, open the test strip pouch carefully, tearing from the slit at the end of the wrapper, and hold the test strip as indicated. Place the test strip into the tube with the arrows pointing downward. Set a timer for 10 minutes. Leave the test strip in the tube for the full 10 minutes. Do not handle or remove the test strip before the 10 minutes are complete. At 10 minutes, remove the test strip from the tube and place it on the strip outline included on the user instruction sheet. The results should be read within 5 minutes after the 10-minute timer stops. Invalid or inaccurate results may occur if the test strip is read beyond the recommended 5-minute time period. The result of your test is displayed in the center area of the test strip. Compare your result with the diagrams on the user instruction sheet. A positive result is indicated by the presence of a blue line and a pink line. Look closely. Even a faint pink line is considered positive. A negative result is indicated by the presence of a blue line without the presence of a pink line. An invalid result is indicated if the blue line does not appear, even if a pink line appears. An invalid result also is indicated if you see no line. If the test is invalid, a new test should be performed. Discard your materials and begin again with a new pre-filled tube, a new swab, and a new test strip. Once you've completed performing the test, all the test components should be disposed of in your household waste. Once you have the results of your QuickVue At-Home OTC Covid-19 test, refer to the user instructions or contact your healthcare provider for next steps. For customer support in the United States, call 833-784-2588 or visit us at QuickVueAtHome.com.